we have de-epithelialized this much of tissue, right? And the whole reason is we expect to have least bone or little bone support on the buccal side. This was an immediate implant that was placed. So in the CBCT, when you check, we happen to have a very little bone on buccal side for several reasons. Now we need to increase the thickness of this tissue overlying the implant on the labial side. So we are going in for a new technique, a relatively new technique called as a roll-on technique, wherein this tissue is going to be rolled. This much of epithelialized tissue is going to be rolled inside, and we are going to expose the implant, place the healing abutment, and suture it around it, so that we expect to get some amount of thickness over here that will definitely favor the life survival rate of the implant. Okay. Oh. What are you doing? Yeah, as you can see here, the implant is being exposed. Positively, it had a lot of bone over it, but unfortunately not much on the labial side. All the three aspects it has got bone, but not on the labial side. One reason could be that it's an immediate implant, and for some reason it never had much of buccal bone. So now this is the tissue that has been raised on the buccal side. Now this tissue can be utilized to roll inside, and eventually we can have a thicker crustal peri-implant mucosal region like this. So this particular flap which you have raised and kept, which is de-epithelialized from outside, we have extended a little more of its incision to the crossing the mucogingival junction, so that this flap can be elevated a bit more. It will be relieved. Now we are going to roll it and place it around the healing abutment after placement of the healing abutment in place. Okay, so we are going to operate on this much of tissue, which is presently overlying the implant underneath it. Yeah. Now this tissue that has been epithelialized and kept, we are going to roll inside like this, so that the epithelium strip tissue will go inside and will get rolled in like this, and then we are going to suture it through the outer portion. So this tissue will stay rolled inside here. and the suture is going to be given from a much apical area, from here and here. So that's it's a rolled flap. A flap that has been rolled inside. It's called a roll-on flap, especially designed to increase the soft tissue thickness over the implant in such cases of implant which has got enough support from all the other sides and bare minimum support from the labial side. So we need to have a thicker phenotype of mucosa over the peri-implant mucosal region, that is here. Okay, so this is going to be rolled on, rolled inside. So this is called a roll-on flap technique. For this, we need to first fix this roll flap underneath it. Reset. have a closer look. As you all know, in plastic surgery or flap surgery, it's all dependent upon how much blood supply you can supply to this graft or flap area. So a vertical incision left without suturing is hindering its blood supply. So giving as much as sutures possible to make it a primary healing. It's a vital thing in these kind of surgeries. So what we are given is one first incision to secure the roll inside, then one incision on the distal area to keep the rolled tissue there intact, then one on the mesial side and one on that extra vertical incision which we have placed. So if you see this region, you have this rolled tissue here, then sutures being given to stabilize it. So what we aim is we'll get a more thicker peri-implant mucosa here. Thicker the peri-implant mucosa, lesser is the chance for peri-implantitis or peri-implant mucositis. So we expect to get a good mucosal coverage here with enough thickness that it will support this implant, which has got bone from the distal area, from the mesial area and from the palpal area very much, but on the buccal side the bone is much less, or you have a membrane of bone over the implant, which is a good indication. The rest is, let's see, we'll be showing you the follow-up as we proceed with the processes.